Well, congratulations, you are getting started on your Invisalign treatment. And typically we would be starting this process here in our office, but due to obvious circumstances, we are getting started remotely. So I'm gonna walk you through what you can expect when you get your aligners and first starting to wear them. Because if you haven't worn any sort of clear retainers or anything like that on your teeth, it can take a little bit of getting used to, and I'm gonna go through some of the basic instructions. So what's going to happen when you get your aligners and some of the starter kit? I'm going to walk you through that. So first and foremost, you are going to get bags that look like this. It'll have your name here, but each bag is numbered 1, 2, 3, 4, so forth, going through the series. So you can see the sample bag is bag 1 of 1. You will probably have bag 1 of 10, 1 of 20, so forth. So you're going to open up bag number 1. I'm going to use my personal aligners as an example of what you're going to do when you go to put them on, because you are going to need to practice probably in front of a mirror the first few times you do this. So when you pick out your aligners, you should be able to tell which one's top, which one's bottom. The bottom have the smaller teeth, top bigger teeth. And what you're going to do when you put them on is you want to line them up first over your front teeth and then all the way to your back, and then push them down there. Now to take them out, it's best to loosen in the back. Some people find loosening from this side easier. Some people find coming from the inside, like that. I personally find coming from the inside a little bit easier, but practice that. But always remember, when you're putting in, line up the front first and then push down the back. And then when you take them out, it's the opposite. You take out the back first and then the front. If you try to only pull on one side, you can see it's a little more awkward. So get used to this, because this will be your life for a couple of months, taking them in and out. If you have any questions or concerns with that, call me, let me know. Let me wash my hands real quick. Now I'm going to go through what to expect in your starter kit, because you're going to get some information here. You're going to get a folder that looks like this. It has an instruction page in here that's going to go through everything, what to do to follow wearing your aligners all the way through to what to do every day. First and foremost, you're going to wear those aligners. It says 22 to 24 hours a day. Yes, you can eat in them. You might find things on the internet that say not to. If there's a difference between you taking them out for long periods of time or just keeping them in, I'd rather just keep them in. You're going to make it through treatment that much faster. You are going to be switching based on the switch schedule that I write on this line right here. Something to pay attention to is that whenever you put in a new tray, it might feel tight. That's normal. When you're going through treatment, do your best to avoid taking anti-inflammatory pain medications like ibuprofen or Advil. These actually counteract some of the bone movement that we need to have happen around your teeth while you're going through treatment. Instead, try to stick with Tylenol or aspirin if possible. The next step number 4, is honestly one of the most important things that you can do during your treatment. So I'm going to put my aligners back in just so that you can see what I'm doing. Top, bottom. So you're going to get something that looks like this. This is your Ortho Mikey, your best friend during treatment, because you're going to be chewing on this a minimum of 10 minutes in the morning, 10 minutes at night, and anytime you put your trays back in. It's twofold purpose. First and foremost, it's going to make sure that your trays are pushed all the way down. Secondly, the constant chewing motion back and forth for 10 minutes will add a massaging action to not only your teeth, but down through the teeth to the bone to allow the teeth to move properly. So you're going to see that each of these have little slots. There's one big slot, a smaller slot, and then this double bump slot. The big slot's designed for your top teeth, the front, to bite into. The little slot is for the bottom front teeth. And then this double bump is for your back teeth. So you can see how I'm biting down into that. So when you bite into it, it's going to feel firm at first. And you want your teeth to sink into it like that. That's how you know that the tray is engaging onto your teeth properly, but more importantly that you're getting that massaging action that you need in order for your teeth to move properly through the bone to the position that we need them to get to. So best friend, hold on to this. I will likely switch you to a new one halfway through treatment, but yeah, this is important. All right, a few more things that you will see on your instruction form is keep all of your aligners after you switch from one to the next. Very important, if you break one, lose one, you're going to go back to the most recent one until I give you the go-ahead to move to another tray. Cleaning, we get a lot of questions about how to clean them. I do give you a travel size of this material here. It's called white foam. It's a pump version of a cleaner that goes pumped into your trays. So you're going to do a half pump on the top, half pump on the bottom, and then put your trays back in. You wear your aligners while this is in. It's a peroxide base, so it kills bacteria, which is what makes the trays dirty and also gives you fresh breath. A couple other things that are included in your kit. You will see a little file like this. This is not for your nails. This is if you ever notice a rough spot that is on the edge of the tray. Sometimes they'll get a little rough spot that's bugging your lip. Then you can use the file to just gently smooth that off. And again, just for comfort, we want you to have that so that there are no issues. Of course, if there are any questions or concerns as you're going through wearing the aligners to start, you can call me, you can email me. When we do get you back in, we will be adding on the attachments. I know we've talked with you about that. So like on here, we've got these extra little bumps here. So we'll be adding those on at a later date. All right. You're gonna do great. I'm excited for you, and I will talk to you soon.